Citizen Television, my goodness, questions coming in thick and fast. Dr. Eunice Durang, Dr. Koinange, my goodness. You guys are raising, at least you're reassuring people, which is important. Let's reassure them again, Dr. Eunice, that this drug is free, right? This vaccination is free, sorry.
Yes, the first one is free, yes.
Nobody pays.
Nobody will pay.
Yeah, no one pays because, as I said, it's given to Kenya for free.
Mm-hmm. But then the cost from the warehouse to the depot, from the depot to
those are small costs that the government covers, just the way they cover Linda Mama, just the way they cover, the government finances the health system. Yeah. So the vaccine doses are free, and they'll be free at the point of administration. And that is going to be that way for the longest foreseeable future, because Kenya is receiving more doses before the million, beyond the million doses of yesterday. We are receiving another million, another 2 million, and hopefully we should receive up to 24 million free doses. But that's not to say that eventually, when the vaccines may be available for sale to private sector, that somebody who feels they can afford, they can walk in to a private hospital and get it and pay. Just like now, the childhood vaccines are free. But, Jeff feels he has enough money, so he's not going to queue in a public hospital, takes your child to a private hospital, and you pay consultation fee and you pay that kind of thing. But for now, in public hospitals, and even where they're going to be given in private or faith-based, free.
Speaking of privilege, politicians out there might want to jump that queue and get that jab. What's the deal? What's the protocol?
Well, I have had a very long debate on Twitter today on this issue. So don't get me started. But let me just answer your question that there is a priority list, and that priority list is clear. It's been debated. I'm a member of the task force. We've debated it. It is kind of mapped against also other countries as well, WHO recommendations, and is a risk profile. Now, therefore, if you have a politician who is a health worker, they receive it. If you are a politician who has hypertension or diabetes, they will receive it. If you are a politician who meets the age criteria, they will receive it. But that's not to say that a politician cannot sneak through the system and receive it. We know they will, but that's not the official policy. The official policy is this is the priority list. But there is no priority list for, say, prioritize politicians. That has not been discussed. If it's discussed in future, we wait to see. But for now, it is the priority groups that I mentioned.
Yeah.
But that's not to say they won't. And if they do jump the queue because they're politicians, that's stealing. It's basically just the way they would if they were doing some political something and they do a gimmick which is unacceptable.
Sure.
It's corruption. And that's we have it in the country. So we are not saying they won't. They probably will get, but it's not official policy.
Yeah, people should just carry their cell phones and just film it.
Exactly. Yeah.
Dr. Eunice, for 40 years, there hasn't been a cure for HIV. I remember early 80s. Remember early 80s when HIV came up? There's never been a cure. Cancer, for centuries. All of a sudden, there's a vaccination for COVID. I mean, that's why people are... I'm sure you're getting these questions as well, right?
Those types of questions are there. But my take would always be for every disease has its own disease pattern, what causes it, and how the disease happens within our body. When you look at COVID-19, or the COVID virus in this case, I think it's a flu virus. We've always had some form of flu or corona type of vaccines in the market. The fact that somebody has been able to make that vaccine does not necessarily negate the value of that vaccine just because there's another disease that doesn't have a vaccine. Same thing with children immunization. I mean, there are diseases that are immunizable, even for young children, but there are those that are not. It is what it is. It's the science. It's the possibilities that are there. It's also the efforts that might be put in place and the ability of people to actually come up with solutions for certain things. So I think it's a misnomer to imagine that because there's no vaccine for one disease, then therefore any other vaccine that comes up is problematic. I think to me that argument does not necessarily follow in that case. And going back to what Dr. Gitahi said earlier, COVID has a lot of attention. So we have so many angles to this story, but we don't necessarily have the same angles to any other vaccine or to any other disease. So it's just that time. It's just been a difficulty, let me put it that way. And this particular virus has really been very challenging for many people.
Dr. G, I like what Dr. G just said. It is what it is.
It is what it is.
Huh?
I love what it says. I can't add anything because that's exactly it. Every disease has its profile, its science, its research. Every virus or vaccine has its base to use. And this found that there were many researches going on flu, on other viral diseases, and therefore just built on that platform. Others are starting from scratch. They are more difficult. Even cancer, there are some cancers that have vaccines. Cancer of the cervix, which kills many women, has a vaccine, as HPV. But some cancers don't. So every disease has this platform. So perfectly explained by Dr.
There are skeptics who say this AstraZeneca also, it's being rejected in some countries. What do you tell them?
No, it's actually not being rejected. So let's say, and there's a story we didn't finish. So when we talk about COVAX, we say then the COVAX says we are going to get vaccines for countries, then looks for manufacturers who have actually done the vaccines. Those manufacturers invest money to do research and development of the vaccines. So right now we have approved AstraZeneca, we have approved Pfizer, we have approved Moderna, we have approved Johnson & Johnson, okay? And also there are also vaccines, Sputnik from Russia, Sinopharm from China, that are approved. But COVAX is only taking the ones approved by WHO, okay? So then that means we have a choice of 3, Pfizer, Moderna, AstraZeneca, and now Johnson & Johnson. Now, when you start administering, South Africa has a mutation or a variant which has now spread. 89% of all their cases are now the new variant. So they decided to administer AstraZeneca, and they used a very small sample, about 2,000 people. And they also checked these people who had very mild disease, not people with severe disease. Early results said the effectiveness is lower than we desire. Not that it doesn't work. The effectiveness is lower than we desire. And the government, out of extreme caution, decided, why don't we put it on hold as they continue with the research, and then we have access to Johnson & Johnson. Why not? So this is basically what happened. And for countries that don't have that variant, there's no reason why not use AstraZeneca. Exactly. And in Kenya, if you look at Kenya, I think we only have 6 cases of the South African variant identified so far. Well, South Africa, 80% of their cases are that particular variant. So you may want to take caution. Yeah.
And our numbers, almost 1,900 dead the last 1 year.
Yes.
Is that a concern for you both? Are you concerned about that?
Any death of any person should always be a concern, particularly if it's preventable and if there's something we can do about it. So yes, it's a concern. The death rate versus the infection rate, what we have right now in the country, is not that bad. But like I said, any death should not really be acceptable. It should be a concern. And if this vaccine comes into the market as it is right now in Kenya, it is a solution to a problem. It reduces the severity of the disease. So by reducing the severity of the disease, we are then reducing the risks of how many people then lose their lives because of the COVID-19 infection.
Yeah. But overall, this country has managed this pandemic pretty reasonably, you would say, Dr.
I would say pretty reasonably. I think the measures that have been taken all the way from the beginning, the borders, the social distancing and everything else, have actually helped Kenya significantly. If we had left it free, open, we would have had a much worse situation. So yes, I would say, well done.
Yeah. So lift the curfew or don't? Don't answer that.
Yes, thank you for saving me.
We don't know what's going to happen in the next few days. Let's go to the magic wall. The questions are coming in thick and fast. Amos, here we go. What about those who are allergic to chicken and egg? Are they exempt?
So let me raise this issue because it's been very controversial.
Okay.
Let me say this, that there are certain vaccines that we've been using for many years that are cultured in eggs, meaning that they develop and they are created with egg proteins, meaning that when they are being administered, people who are allergic to egg proteins may be advised not to take those vaccines because then they have a high likelihood of getting a higher allergic reaction. Now, none of the COVID vaccines, none of them has been cultured in eggs. None of them has any traces of egg protein. So there's no contraindication for egg allergy, scientifically out of the manufacturers, WHO or any other. The only allergy that we advise is anything that's a component of that particular vaccine that you may be allergic to, all the components in the vaccine. For this one, no egg allergy, no chicken allergy, so there is no contraindication as far as the science I've looked at says.
I didn't know that. Thank you for that. I thought it was just what came first, the chicken or the egg.
No, James, no.
My bad. Eric wants to know, do we know how long the immunity conferred by the vaccine lasts? That's a good question. 6 months, a year? How long does the immunity last?
The data I've seen says several years.
Oh.
It says several years. Of course, no one knows the exact number of years because we have had this thing for only a year. But the data available says after you receive your second dose, it should give you immunity for several years. So we have to wait and see how many those several are.
Yeah.
Yes.
It's like the flu bug, I guess, huh?
Yes, exactly.
Flu shot.
The flu shot, you have to repeat. Some of them you have to repeat, you have to do.
Yeah.
So data, if you look at the yellow fever vaccine, we used to say every 10 years you have to repeat it. But now WHO has come and said, oh, you don't repeat yellow fever. So data and science progresses. You won't have all the answers today.
Betty, is actually what Dr. Yunus was talking about earlier on. Has there been enough civic education to ensure buy-in from the public? Who should be doing this? How should it be done? Is it what you were saying, right?
Yeah. I think more can be done. A lot more needs to be done because you need to ensure that every person in any corner of this country understands about the vaccine, understand about COVID, and is able to be, ready to make a decision about whether to get the vaccine or not. Who should be doing it? I think every healthcare worker. We need to utilize the community healthcare workers. Like everybody who has access to the correct information should be able, at the contact with a person from the public, to give that information and give it accurately.
Okay. Jomo is asking, is talking about Swiss cheese. I love this formula of Swiss cheese. This whole vaccination goes up to 2023.
Yes.
Will we need to keep wearing masks until then, when the majority of the population will be vaccinated?
Well, I would say yes. I would say that let's keep the measures that have been given until when we know that an adequate number of the population has been vaccinated. For now, we should look forward to continuing to do the measures that we are doing right now. But at some point, they will drop off. But we don't know when.
We don't know.
Yes.
But in the meantime, wear masks, sanitize, social distance.
Exactly. But I can tell you, if you look at Israel, Jeff, they have vaccinated probably 60% of their population now. Hospitalizations, infections have dipped. So we know that the vaccine works. So let's maybe, as we move forward in a few months, maybe in a year, new science, new data, and we'll have to drop off doing all these things, but we don't know when. So for now, I think the safe thing to say is let's keep the Swiss cheese strategy.
Well done. Wafula wants to know, what if we find this vaccine ineffective like South Africa did? What will we do? Will we consider getting another type of vaccine like maybe Moderna, Pfizer, and Johnson & Johnson?
It's a rolling. It's rolling. For now we have AstraZeneca. We use it. It's going to be effective. If in future because even if AstraZeneca is effective, and it is going to be, we will still get Pfizer probably at some point. We will still get Johnson & Johnson because the volumes required by the country cannot all be fulfilled by one manufacturer. That's the thing that people need to remember. That the reason we're going to get a mix is because of supply. The supply is not enough for one to give you all the vaccines you need.
So phase 2 might be a different drug?
Yes. Yes. As long as each person receives the second dose of the same as they received for the first.
Right.
But different populations could receive different vaccines.
Right.
Because of supply.
Chabet, by the way, did we get any advantage from participating in the trials for this Oxford AstraZeneca vaccine? Even in terms of efficacy or cost? This is the one that was tested here in Kilifi, yes?
Yes, we did, because let me put it this way. That if Kenya wanted to purchase directly from AstraZeneca now, they have a priority of access because the tests were done here. But because we are getting free ones from COVAX, then we are not going directly to purchase. But if Kenya wanted to purchase, that's when you would realize that benefit. And obviously the benefit, the fact that it has been tested in our population and therefore we know that it works in our population. That's a benefit.
Exactly.
As it is.
Which links to...
Correct. Right? Go on, Dr.
Yeah, well...
The fact that we didn't take part in the clinical trials, we did.
We did. I think we do know how the vaccine works in this type of population. So, yes.
You see, there's so many critics, there's so many skeptics.
Yes.
So many myths being peddled out there. I guess we have to just keep talking. Crimson cream. Oh, there we go. Yeah, we can go to the next one. This one has been answered. Next. So many tweets, so thick and fast. Pesci wants to know, kindly ask Dr. 1. So when one gets the vaccine, do they continue with observing the COVID-19 protocols, or what happens? Educate so that we get a clear understanding. Swiss cheese.
Yes, you have to continue observing the protocols, because the person next to you, number one, the vaccine does stop you from getting infected. It just stops you from getting severe disease. And you don't want to be the one spreading the vaccine, the virus to other people. So until a critical mass of the population is vaccinated, we should keep wearing our masks.
But what is a critical mass? Give us a number.
We think now it should be, from what we've had, maybe 60 to 70% of the population, and that's going to take some time. Yeah, 60 to 70%.
Wow. Preet Singh, he's in Dubai. He says, Dr. Yunus, I am well after 2 doses of the COVID vaccine. Dr. Gitai, mild laziness was the worst for the first 24 hours. 25 days after the second dose, life goes on with another level of safety, but mask on at all times.
Exactly.
And Dubai got, I think, the Sinopharm,
Sinopharm.
Right?
Yes, Sinopharm. The Chinese one. Then they have, UAE has vaccinated just as rapidly as Israel. Actually, doses per population, UAE, Israel, way up there.
But Preet says he got a bit of nausea.
So maybe, yeah.
So it's again going back to the side effects. So she had a bit of maybe laziness, so tiredness.
Yeah.
And she says after that, life goes on.
Yeah.
So, she must have been aware of what the side effects are. They were mild, and she was able to go back to her usual life. And then, as she says, continue wearing her mask.
Yeah.
Yeah.
Preet's a he, by the way.
Yes. Sorry.
It's okay.
He.
Why Brian says, I have been waiting for the vaccine, but I'm not a health worker nor a frontline worker. So when will my time come to take the vaccine? Because I'm just as scared as anyone else being given first priority. That's a valid question, huh? Yeah. How long do they wait? Do we know?
You see, the plan is that by probably end of 2022, we may have adequate vaccines for as many people as possible, and maybe early 2023. So if you look at the current plan, it's looking to vaccinate 15 million people within that time by probably just early 2023. And it's likely that whoever is asking that question will probably be somewhere in between there. But it could be accelerated. How could it be accelerated? Because as we do this, more vaccines could be approved, more companies could start to manufacture them, and therefore the volumes may be more available, and maybe eventually we'll get companies finishing phase 3 and they are approved to market, which means private organizations can now buy and give. So there could be so many things that change between now and the end of 2022. Yeah. So we keep our hopes high. But you know what? I'm happy about that question, because that means that somebody who knows the vaccine will help their lives and they're eager to receive it. That's what we want to see.
Dr. Yunus, the bottom line, and the feeling I get from most of these questions, most of these concerns from people, will life ever go back to what it was, what we called normal? That's what people want to know.
I think that's an interesting question, because with the experiences we had last year and we're having this year, everything about our lives will change in terms of how we look at life, in terms of how we do things, in terms of even how our healthcare system is organized, in terms of how we respond to diseases and infection. Will we go back to not having COVID? Maybe, if we get everybody immunized, if we get, ensuring that everybody's vaccinated, that the disease trajectory goes down, that the infections are not peaking. But today it's COVID. Tomorrow it might be something else. The world is changing. Disease patterns are changing. So for me, I take this as a lesson, and I take this as an opportunity to say everything we've been through sets us up for success, for anything else that might come up in the healthcare system.
Dr. G, you agree?
Completely agree that life is going to change. And as people keep saying, it's not if we get another pandemic, it is when. So this is just a rehearsal to strengthen our health systems, to strengthen our resilience, our own resilience, change the way we work. Virtual now has become kind of the way to go. And also, I don't know whether I gave you this story before. My mother, who lives in the village, always had asthma attacks because she got recurrently infected in her chest. She's asthmatic. And since February last year, she's not had an attack because everyone around her is wearing a mask. She's not going to meet people out in the village. So it's a new way of life, not only for COVID, but for our own health.
Yeah, but it makes our folks a lot more lonely, doesn't it?
It does. But even you know, as we now get the vaccination, it means now you can actually more and more go and visit them. Even now people are visiting them, as long as you know that you need to wear your mask, you need to keep your distance, there's no hugging, there's no contact. You can still visit them and, and talk to them. But of course, if you're not able to take those measures, then don't go anywhere near them, because we've seen infection goes up and down. But yes, our lives are not going to be the same again. But I think in many aspects, they're going to change for the better.
You think so?
I think so.
Dr. Eunice, you agree?
100%.
Life will get better at some point.
It will get better. We've learned lessons that are making us better people, better systems, so it will get better. And I think, as he said, we are just better armed now to face whatever else comes.
Yeah, and the planet gets to breathe.
Yes.
Didn't someone say that once, yeah? It gets to breathe again.
To breathe again, yes.
So you're right. There could be, there's some silver lining to this pandemic.
Yes.
Wow. Dr. Eunice Durango, thanks so much for your time. Unless you have some final words you want to give. Yeah, let's reassure some people. Talk to Kenyans out there, especially the skeptics. What do you tell them?
I'll say the vaccine is here. It's arrived in our soil. We should get vaccinated. We should get the right information out. We should receive information from the right sources. And let's keep wearing our masks, sanitizing, maintaining that distance until we get to that point when it is safe not to do so.
Very good. Dr. G, you get the last word.
Vaccines are safe. We've used them for years. They helped us to end smallpox. They have helped us to reduce deaths from measles, from our own children. They have helped us to avoid TB. They have helped us to avoid so many other things. Mothers who are pregnant get tetanus shots so that they don't get tetanus during their delivery. So vaccines have been with us for years. This is just one extra vaccine. And as long as we have the assurance it's safe, like we've had now from what we call stringent regulatory authorities, we should be calm and confident and trust the vaccine, that vaccines can save lives and will save lives. So let us participate, and when we have questions, let's ask them genuinely. And if you have misinformation or disinformation, desist from pushing it on yourself. If you have something that you think this is not valid, don't push it to others just for a laugh, because you're actually creating hesitancy. So I'm here asking for personal responsibility. If you don't believe in something, ask a colleague, ask somebody, ask your local doctor, ask your nurse, ask your community health worker, before you push it on to other people just for the purpose of propagation. Yeah. So let us believe in the vaccine. Science has given us the vaccine to protect ourselves and protect the loved ones.
Dr. G, I have a very good friend of mine with your very same name, and his name is Gitahi. I should give him your number.
Please do. You never know.
Dr. Eunice, thank you for reassuring a nation. I think you've done a great job. Thank you very much. Let's keep talking. Let's keep talking.
Let's talk.
Because, this stuff, it can get scary, but we're all in it together. Right?
Thanks for the opportunity.
Thank you very much for the chance. Thank
Appreciate that. Well done. Wow, what a conversation. And I hope we've answered most of your questions. I know you have plenty of questions, but we hope we've answered more, and we'll still keep having these shows, even as we continue to vaccinate. When am I in line again? When am I? 2023. Okay.
Probably.
Thanks for watching Jeff Koinange Live. Every Wednesday, it's all about those three letters on the keyboard that follow each other. JKL. Thank you all. Stay safe. Good night. Good luck. God bless this nation of ours and our frontline workers, indeed. Well done, folks.